at the FDA and then switched over to outreach in the school system. I find this work really engaging. I don't come from behavioral health, so every day I feel like I learn something new, whether it's from my wonderful colleague Matt or from Nicole, and I just enjoy this work immensely. And I'm happy to be here, and I want to really thank Nicole for letting me into the space today to share about 988. Go ahead, Matt.
Yeah, thanks, Elizabeth. Good afternoon, everybody. My name is Matt Scanlon. I'm the lead of the diversion work stream within the 988 program at the Department of Health. So I work with 911 public safety answering points and 988 partners on efforts supporting the transfer of calls between those two systems. I've been working in public health probably 7 years now, but have worked in emergency services and have had positions with mobile crisis teams before. So have some background in the behavioral health side of things and emergency side of things. So, but I've been with the 988 program at DOH for a little under a year and a half now. Yeah, thanks for having us today. Back to you, Elizabeth.
Go ahead and go to the next slide, Matt. So we're going to ask you if you could take a few seconds to grab your phones. I'm going to also drop it in the chat if I can also find my little document. If you could fill out this QR code to let us know how familiar you are with 988. Some of you may be really familiar. Some of you may know a little bit. It's just a 5-point scale. It helps us go back on the 988 side to let us know from beginning where we're starting at and where we finish. In general, there's like about a 20-25% awareness with 988. We're hoping at the end of this, you're going to be really confident talking about 988 if anyone asks you about it, and you'll be like, hey, I know all about 988. And you'll feel super confident that this is a great resource for everybody to use. That's kind of as I go out tabling and when I present to groups, whether it's EMS or teachers or students, that 988 is for anybody at any time, anywhere. And I really want people to have confidence in that and feel that they can use this service at any point and they're going to always be met with a trained counselor. I do tend to talk quickly, so if I'm speaking too fast, raise your hand or put it in the chat and somebody will ask me to slow down. But we do have a lot of material to get through, so someone is not muted, so if you could maybe... Before the bedroom door opened, I turned to see... Thank you.
Like that was coming from yours, I believe.
No?
Okay. I don't see anyone else muted, but we'll keep an eye on there.
I got nothing here. So if I do go too quick, just put a chat, shout out or raise your hand. Thanks, everybody. Next slide. Go ahead, Matt. So sometimes there's music that accompanies it and sometimes there isn't. We never know when it's going to play. But what I really want folks to take away from that is that I hope you can tell that really there's no wrong reason to use the 988 resource. Any reason's the right reason. You can see that, you know, it could be stress about money, worried about your relationship, drug abuse, any reason. Am I drinking too much? Is someone I know drinking too much? Again, any reason, there's no wrong reason to reach out and use the 988 resource. And I've dropped that video in the chat links, and I will also send this slide deck over to Nicole. So folks will have the resources, and we'll also provide all the links via email. Next slide, Matt. So 2020 is when federally the National Suicide Hotline Designation Act was signed, and it was kind of an effort to bring it all together across the United States. So whether you were in Nebraska or Washington or Virginia, you would have the same resources. You could dial this number and it would be the same. In Washington State, we're a pretty proactive state in terms of our health proactivity. We passed our bill 1477. Laying the groundwork for what it was going to look like in Washington State. 2022 July, it launched, including our Native and Strong Lifeline, and I'll talk about that after the slide. And it also launched federally, but only Native and Strong Lifeline is in Washington State. 2023, after a year of 988, we realized we needed some more legislation to support the work here, and 1134 was passed. And that's talking about making sure we have the right materials out there and campaign to promote 988. We're hoping by 2027, we're going to have a complete crisis center platform, and there's going to be no wrong door to get into the system. And everybody's going to be able to access 988 no matter where they're at, and what they're going to be able to always have that support and get into the mental health support they'll need via 988. Next slide, Matt. So it is a 3-digit calling code. You can text, chat, any way you need to get in. It's there for you. It's free. It's confidential. It's available 24 hours a day, 7 days a week, 365 days a year. However you access it, you are always going to have a trained counselor there. It's never automated. It is not an AI. It's not a bot. I get those questions quite a bit when I'm out in the field. They're always going to be met with a trained counselor who is going to de-escalate whatever's going on in that moment, get them to a place of calm, help them safety plan, and then offer them some resources. Again, a loved one can also reach out and use this service. You know, if you're worried about somebody, they're going to give them ways to de-escalate and get that person to a place of calm, and maybe even ways to encourage the other person to contact 988 for themselves. I think it's really important that as we navigate this system, that it's helpful to let other people know. Again, always, it is a person on the other end of that line waiting to help them. And there's no wrong reason to reach out. They're always going to be a trained counselor to get them to a place of calm, help them safety plan, and get them. One of the words I hear repeatedly, and that on a national level, they're starting to incorporate it back into their literature, is hope. Matt and I are sometimes at events, and people will come up and say, you know, this is offering me hope. In that crisis, in that 3-second window when I was struggling and I reached out to 988, I was offered hope. And that's what this is doing. And that's what we're so happy to be able to have, you know, as Washingtonians, we're able to do this service for folks. Next slide, please. In Washington State, we have 3 lines. The Veterans Crisis Line, which is federal as well. You call 988 and you can press 1, and you're going to have folks trained in issues related to veterans, or also you could be a member of you can be a veteran related, as I like to call. You can press option 2 for Spanish speaking, and then we have option 4, the Native and Strong Lifeline. Available nationally also is ASL. You click off your phone or your laptop for deaf of hard of hearing, and then they're also off the 988. You can do 240 languages and dialects. And as we evolve, we're always learning ways we can improve this service. And the goal is to always be reducing barriers. We want this to be accessible to all Washingtonians. And so always changing, always adapting is very important. And so as you all are out there in your roles at DVA, reach out and let me know. Reach out to Nicole. Nicole and I are in contact quite a bit. And Dawn, I'm on the Governor's Challenge with them, and we just converse a lot. If you find ways you're hearing people are not accessing, please reach back out and let us know. We're always adapting, and feedback is the best way for us to learn. Thanks. Next slide, please. the Native and Strong Lifeline. This serves all the Indigenous people in Washington State. Again, you're going to they press 4. The counselors are tribally affiliated. They are trained just like all the other counselors in intervention and support, but they also then get extra training with a special emphasis on cultural and tribal practices. It's the only program in the US, and we're very really proud of the partnership with our tribal government partners, and they work with Volunteers of America in Western Washington to run this program. In August of 2025, the chat and text portion was also added. So now they also have complete services like all the other lines: text, chat, and calling. Next slide, please. So our partners in this work, there's 3 crisis centers that do this work. Volunteers of America, they handle the western part of the state and the lower southeastern part. King County is handled by Crisis Connections, and then the northeast part of the state is handled by Frontier Behavioral Health. Volunteer of America and Crisis Connections also handle all the text and chat. One of the new things, as I mentioned, we're always evolving and learning. All the calls now and text and chat are handled by geo routing, which is new. Originally, 988 was handled by area code. So you were routed by area code. Well, now feedback callers and users of this service want to be routed to the closest crisis center. So now you are routed to the closest crisis center. We don't know where you are. You are still confidential. You are routed by VPN. So 10 or 15 mile radius to cell tower, and then you're at the closest crisis center. If that center cannot pick your call up in the closest amount of time, it will go to the next center available. If by then we still can't handle it, it will roll over to a national line. We answer the majority of our calls in state. We're really happy that we are able to do that. So Washingtonians are able to get help from counselors trained in Washington. Next slide, please. Our counselors in Washington are paid professionals. They're not volunteers. They don't have to have a specific degree or credential, but the majority of them do have bachelor's degrees. Many of them come to this work with lived experience and a very strong desire to help those in crisis, and many of them also have lived experience. Their supervisors must have a bachelor's degree, and also the majority of them have master's degrees. Those that have master's degrees are our licensed clinicians. As I talked about, we're always evolving. One example is that they always are adding new training. So I'm sure many of you have heard of the federal government did cut the LGBTQ youth line in July. Very quickly, our centers reached out to and asked us, what training do we need to serve this population? It is a high-risk group. They suffer from a high rate of mental health struggles as well as death by suicide, and they quickly undertook the training required to serve that subpopulation. We are currently in the process of evaluating IDD training, so intellectual and developmental disabilities. We are looking at developing training for 911, 988 diversion programs, which Matt will talk about. So we're always evaluating what more training do we need to bring on to make sure those counselors are trained to help Washingtonians using this service. The other thing we do within Washington, and I think it's important to bring up 2 things actually. One is the counselors go through mock training before they start answering calls. And I want to bring it up because in our community of practice, they talk about that as being something they're very happy that they go through. They feel like it makes them better counselors. They feel like it makes them more prepared to answer calls. And the second thing that they do, very early on, our centers realized that like EMS, but even more so, this was a very stressful job, and they wanted to make sure the counselors were supported. They don't want a high turnover in this job. They want the counselors there. They want them to feel supported, and they offered very quickly, make sure mental health and wellness days, and that they have a community of support at each of those centers. and it's a very active program at all of the centers. Each center differs a little bit, but it's a very active program supporting those counselors so that it is in-house and they have the support they need so that they show up for their job and are able to help people, the users of this system. Next slide, please. Again, I'm just going to throw this up there because it is a big concern. Folks are worried. When that line got cut, there was a lot of misinformation, first thinking the whole line was cut. And then, how can people know, if I'm not using a subline, how will they know how to treat me? Or even like if you're a vet and you're calling, I don't want to press 1. And I know Dr. Pruitt's going to talk about this a little bit. What if my commander knows I'm calling? What if I'm calling about my spouse who's a veteran and now they're going to get in trouble? First of all, the counselors are there to treat everybody. They can help anybody de-escalate and get to a place of calm and get them safety planning. That's what they're trained to do. They are ready to do there. They're such compassionate people. I've met them and they're just ready to be there. I'm going to use the term, they're in the trenches and ready to help. And they keep it confidential. So they really just want to get these folks to places of calm and help them safety plan. The other thing is they're well trained, and I really want you all to know that. So you have confidence going forward that that's what they're here to do. And again, I'm going to, anytime, anywhere, anyone. That's what this resource is for. Next slide, please. Here's some of our data. In August, we had 14,000 calls routed and we answered just over 13,000. Average time to answer was almost 19 seconds. Average talk time was 14 and a half minutes. On the text and chat side, 5,200 were routed. They answered 5,000. Average time to answer, 8 seconds. Average talk time, 43 minutes. On the Spanish subnetwork, August was 151 calls. In January, it was averaging about 500, so a big decrease in the Spanish subnetwork. The Veterans Crisis Line, the calls were 2,144, and that seems about stable. It fluctuates, maybe 2,000. I think at times it's been up to about 2,500, but it seems to fluctuate between 2,000 to 2,500. The discrepancy you see between routed and answered, calls can be dropped. If a call comes in and rolls over to a Washington center, it's counted as routed but not answered. If a call comes in, is routed and goes to national, it is still counted as routed but not answered. And then also we do have a disconnect. So if a call comes in and is dropped, it's counted as not answered, and the call comes in routed and the person disconnects. We do see a disconnect at 15 seconds. That's about the part where somebody will disconnect. We're at just at almost 19 seconds, some of the lowest answer times in the nation. The only way to get a lower answer time is more funding for more counselors. So I think everybody's kind of up against that wall. But I do want to emphasize here, the average talk time is, there's no limit. Those counselors stay on the phone until everybody's de-escalated and into a place of calm and they can safety plan. Next slide, please. This is just an outline of when you call. Matt, it's probably not going to play. Let's see. Go ahead, click on it. You clicked, but it takes a couple secs.
It's playing on my computer. I don't know about it on yours.
Whenever you share your screen, there's typically a box to the top right that says include computer audio. And if you select that,
I think I found it. Yeah, share sound. Okay, hopefully it works. Let's try that again.
Reached the 988 Suicide and Crisis Lifeline. Para español, marque el número 2. If you are a veteran or service member or are calling about one, press 1. To connect to support for LGBTQI+ youth and young adults, press 3. If you are of Native descent and would like to be connected to the Native and Strong Lifeline to speak with a counselor, press 4. Otherwise, to talk with a counselor, Stay on the line or press 0. To improve 988, your call may be monitored and recorded. We are checking for a counselor who's available to talk. You'll hear music while we do this, and we'll get 988 Lifeline, hello.
So you can hear it's pretty quick. It goes through it pretty quick. They play music. In Washington State, they offer option 4. Yeah, it's not too scary. We like to play it so you can hear how it sounds. Excuse me. Next slide, Matt. This is my dog Daisy. I like to show her because I had my aha moment that sometimes it doesn't always happen with work, but I did have the aha moment. I should have bought stock in this company. I don't know if you all can see it. She's known as a super shedder, and she's only 25 pounds, and she's a giant ball of fur, short fur everywhere she goes. I invited some folks over to my home. I'm a pretty big introvert, but there's hair everywhere, and I'm furiously rolling my sofa. I keep these all over the house. And I picked up the cushion and there was a bunch of change under it. You can go to the next slide, Matt. But I put that in there because it was just one of those where your work aligns with your home life, which often doesn't happen. And it was some change. And I just kind of thought, what could I buy with this? I think it was like 75 cents, really literally not much you could buy anymore. And I thought, wow, I'm like almost funding 2 crisis lines this month because we're funded by a state fee, a line fee of 40 cents a month. All of us are doing this together. It's 40 cents a month on every cell phone or landline or voice over internet. About 75% of our budget comes from that. It's pennies a day. We get 15% from grants that we apply for, 13% from the general state fund. Again, so the majority of our budget is 40 cents a month. 911, I think, is 99 cents. We'd like to come up and match on that so that we can really offer services equally across the state and get that, call answer down. But 40 cents a month, pennies a day, we're able to offer this. You saw those numbers, 13,000 calls. We're able to do this on 40 cents a day. Everybody, we're all in this together doing this work. Next slide, Matt. 911, 988. 911 is still there for all those same reasons. Urgent threat to life, immediate intervention danger, medical emergencies, crimes in process. What we'd like to take that burden off 911. If somebody's in a mental health crisis, de-escalation, emotional support, and we can get them to that place of calm. 911 is all those right reasons. If someone's in the act of suicide, you can't de-escalate it. And if we call 988 and we can't get them to put their weapon down, we cannot get them to a place of safety, we then will have to rely on law enforcement. Next slide, Matt. That happens in less than 1% of our calls. 99% of our calls, we are able to handle them without involving emergency services. They are able to de-escalate those calls, get that person to a place of calm, get them to safety plan, get them to de-escalate. And I think that's what's so important. Get that message out there. These officers can get them to a place of calm and get them safety planning, which is what we want. We want to take that burden off 911. Let people use this service. Let them call 988 and get that support. Next slide, Matt, which I think is you.
Yep, thanks, Elizabeth. So I'm going to present some details on the 911, 988 diversion efforts in our state. So much of the diversion workstream, which is the workstream that I lead within the DOH 998 program, Much of our work stream has been focused on the mental health crisis call diversion initiative, more readily known as the MHCCDI project. This is a pilot project that occurred throughout the course of 2024. Technically, the pilot phase of that work is concluded, but we established three partnerships between 3 911 centers and the 3 988 centers. We started those during the pilot phase, and those partnerships are continuing onward after the pilot phase ended. And we created that pilot project because alongside crisis system partners, we created that because 988 is still a relatively new service, right? 988's been in existence now a little over 3 years, and so it's still new. So many individuals contact 911 for mental health and substance use crisis concerns, and a portion of those crises can be appropriate for 988. So recognizing that diversion efforts are needed to help people experiencing those types of crises get warm transferred from 911 to 988 again as appropriate, and doing so provides that no wrong door approach for caring for individuals experiencing behavioral health crises. And so the pilot again included the 3 988 centers. So Washington State has 3 separate 988 centers. Elizabeth showed that great map earlier with Crisis Connections, Frontier Behavioral Health, and Volunteers of America. So each of those 3 988 centers were then partnered with a 911 public safety answering point. And so it's important to note that the pilot phase was relatively small in scale. It only included 3 911 public safety answering points, and Washington State has 65 primary 911 public safety answering points. So 911 988 diversion isn't a statewide process currently. We're kind of phasing in this diversion work over time. And with the pilot phase, those 3 911 988 partnerships weren't operating 24/7. They were staffed to do diversion work kind of during anticipated peak call volume hours. I will note that since the pilot phase has concluded, those 3 partnerships are now all operating 24/7 though for diversion efforts. And when we look at the pilot data between February and the end of December 2024, the pilot diverted close to 5,000 calls. It was 4,784 calls. And again, by diverting those calls, that diversion work is providing that no wrong door approach for help seekers and helping them get quickly connected to trained crisis counselors that can help with de-escalation, risk assessments, safety planning, providing emotional support, connection to services, so helping them get connected to different behavioral services as needed, and then also they can offer follow-up calls too as needed. So lots of great support that can be offered by 988 trained crisis counselors. And the pilot phase is really designed to help us kind of gather that formative data on lessons learned, the successes and challenges involved in that work, so that we can go forward with that data to kind of inform future expansion of this diversion work over time. And then kind of another bigger piece of the work in this work stream has been focused on creating a protocol for this work. So DOH and statewide 911 worked with a vendor and our 911 and 988 partners in our state to create the 911 988 warm transfer protocol. And essentially, our work group conducted multiple community listening sessions. We engaged individuals with lived experience with behavioral health crises. We engaged tribal partners, 911 partners, 988 center partners to develop a really robust 911 988 warm transfer protocol, informed by lots of different perspectives from different partners. And really that protocol just outlines like the processes and decisions involved in making those transfers between these 2 systems. So determining which calls are appropriate for transfer and kind of the processes and logistics of making that transfer. And we're also working on creating training materials to accompany that, to train 911 and 988 staff on that process. And really by using that protocol and the training on that protocol, helping to kind of cement these processes within the 911, 988 systems, we're providing that no wrong door approach for help seekers to quickly get connected to behavioral health services. And so, yeah, with that, I'll turn it back to Elizabeth. I think we're getting close to questions, but I don't know if we want to take those now. I think we're going to probably have another presentation first. Or no, sorry. There's another slide.
Nope.
Sorry. I'll pass this one over
Nope.
to you, Elizabeth.
We're good. Just a
Okay.
reminder, anyone can call 988 at any time. Next slide, Matt. Does anyone have any questions? I see a hand. Brian.
Yeah, so one of the things that I know that we kind of bumped into in Washington State last year, and it might be an ongoing issue, is just being able to find mental health resources out in Washington State for folks who are looking for long-term therapeutic models. And I know that one of the things that 988 did do for those who were in that situation was to do follow-ups, at least until somebody could get into a therapy, into a proper therapy channel. Is that something that 988 still offers, or has there been shall we say, an improvement into that field where they don't have to offer that as much?
Right. Thanks for your question. Yes, 988 still does follow-ups. Thank you. Sometimes I remember to say that and sometimes I forget. So I appreciate that. Yes, 988 will do follow-up calls. They'll do follow-up calls. They also will do, if somebody asks, they will come out in person. They'll do a mobile response as well. But there's a new law that passed and they're trying, I believe it passed last year, changing the definition of who can do mental health counseling. And that's going to bring a lot more mental health counselors onto the forefront, I think really opening up counselor resources. But if the person using 988 resources requests follow-up and provides their phone number, 988 will continue to follow up for as long as they request it. So if folks have any more questions that pop up or they're thinking, we're going to move on because Dr. Pruitt has his presentation. Here's our post-awareness check. We do have a link to the forms to follow up with. You don't need to go to the next slide, Matt. We have several resources available that are free. All kinds of magnets, stickers, everything's free. You can request it through SAMHSA. You can request it through me, media kits, talking points, all of that. I'll drop it in the chat. Nicole will also have an email from me where you can request it. And thank you again for your time. And I appreciate it. If you do think of questions, I'm listening to Dr. Pruitt's talk, so I'll be on. I can answer them in the chat. And again, you can also email me or Matt. Thanks, everybody.
Thanks, all.
Thanks, Elizabeth and Matt. Really fantastic work that you all are doing with 988. And I am going to be talking with you about the Veterans Crisis Line, which is one of those subsets of 988. And I was so excited when Nicole asked me to talk about the Veterans Crisis Line because I think this is really life-saving work that happens. I know that from the day-to-day work that I do here at the VA, but also 23 years ago, I was a volunteer King County Crisis Line responder, gathering that early mental health experience as I kind of chose my career path. It's great to see that those are now paid individuals and they have some level of training. At the time, we were just trying to take calls and help people. So let me talk to you about 988. 988 and then pressing 1 gets you to the Veterans Crisis Line. This slide that you're seeing here, this is the cover page from veteranscrisisline.net. And the reason I included this is because it has a ton of information on here already. So first, obviously, 988, then press 1. That's how you get to the Veterans Crisis Line. As Elizabeth mentioned, it's 24/7, it's confidential, it's no-cost crisis services, okay? The Veterans Crisis Line is for veterans, but it's also for their loved ones. And there's no validation, there's no proof that you're a veteran or connected to a veteran. If you call and press 1, we're going to talk to you, okay? Another important thing here, If you're a veteran and you've used VA care, you know that your enrollment and eligibility is really important. The nice thing, one of my favorite things about the Veterans Crisis Line is we don't worry about that. We provide support to any veteran who calls or any family member that calls, regardless of eligibility, regardless of service connection or anything like that. You press 1 when you call 988, you're going to get a crisis counselor. Okay. And as we'll talk about in a little bit, you're going to get follow-up from your local VA. Finally, again, you can call on your phone, you can call on your computer. You can, if this were the live website, you can click and do an online chat if you don't feel comfortable doing a voice call, or you can simply text 838-255, and that's another option to connect you if you feel more comfortable using chat tools. So Elizabeth and Matt did a great job of going through how it works. I'm not going to go through that all again, but I will say that the system is designed to be simple, straightforward, and quick to get you from that moment of crisis to that trained counselor without a lot of intermediate steps, because we know when you are in the middle of a crisis, the last things you want to do are try and pick the right option on the phone tree, or provide extraneous information. You're there because you need to talk to somebody, and we want to make sure that happens quickly. So digging into the Veterans Crisis Line specifically, one, you have a timeline here of when the crisis line originated back in 2007. That was the veteran specific line. Some of the developments since that time, I'll say the last really big one happened in 2022, as Elizabeth pointed out, with the launch of 988. And we'll show you kind of how that has looked in terms of data. But the other thing I want you to pay attention to are these numbers down here, because if you remember when 988 went live, there was kind of a big uproar on social media, and I think it even hit mainstream news about, hey, you got to be really careful if you're going to call 988 because they're just going to send the police to your house, right? And Elizabeth touched on this a little bit. She said 1% of the time. With the Veterans Crisis Line, there has been 8.7 million calls. These are voice calls, 500,000 text messages, another 1 million chats. So you add that up for over 10 million contacts with the Veterans Crisis Line. With those 10 million contacts, emergency dispatches have happened 3.83% of the time. Okay, so a little more than 1%, but again, the majority of the time, the crisis responders are looking to do that de-escalation work to keep the person in an outpatient status and stabilize that crisis while they remain in their home environment. Okay. Now, there's some researchers that are digging into that number a little bit, and they said, well, that includes things like, somebody that doesn't have transportation that's asking for a ride to the hospital, or somebody who's so intoxicated that they can't safely drive. So if we're looking at true emergency dispatches because of a suicide-related crisis, then what you see is that these numbers match up almost exactly to what Elizabeth was saying, with about 1 to 1.5%. I had planned to show a video here. I think I'm going to skip it for time's sake, but you can go to YouTube. You can type in Veterans Crisis Line. You'll get a number of videos. This one is one of my favorites because it gives you sort of a behind the scenes look at what happens when you call the crisis line, who those responders are, and the passion that they have for their work. I will say, when you call the Veterans Crisis Line, you do get veteran trained responders. They're not required to be veterans. Most of them are, or they're a family member of a veteran, but they have training in veterans culture and veterans issues that we see commonly in the VA community. So have a look at that. If we have time at the end, I can go back and show it for folks. What I really want to get to today is what makes the Veterans Crisis Line different. It is a subset of 988. You start by calling that 3-digit line. But when you press 1 to identify yourself as a veteran or a family member or loved one of a veteran, it's going to kick off a slightly separate process. And what makes the VCL different is that after you call and you deal with the crisis, and it sounds like we have a couple open mics maybe. So after you call and the crisis is resolved in that initial phase, you then, with your permission, if you want to identify yourself, you're going to get forwarded to your local VA hospital for a trained social worker to follow up with you and make sure that not only is the crisis fully resolved, but what are the next steps of care that we can offer you? What are the community resources that you might qualify for? What needs to happen in addition to that crisis response to ensure that you don't go right back into crisis? So right now, there are more than 600 suicide prevention coordinators nationwide. Every single VA hospital, right? So not our community clinics, but our hospitals have at least one, most have several suicide prevention coordinators that are following up on calls to the Veterans Crisis Line every single day. So you'll hear me talk about suicide prevention coordinators. You might wonder, what is that? This is a statement from Dr. Matt Miller on the program. And I just highlighted a couple of things here that are really important to know about suicide prevention coordinators. So one, they are specially trained individuals working as mental health providers. They are tasked with finding support and crisis services for you. They are a guide to navigating the VA system. So a large part of what we do is crisis related, but the other significant portion of what we do is just helping you navigate access to care at the VA. You'll see us outside the VA at community events. We do a lot of outreach. We do a lot of promoting of 988 so that folks know that it's available. But we're also working inside the facilities to respond to those crisis calls. And we do a lot of other things within the mental health services at the VA facilities. And finally, 988, whether that's the call, the text, or the chat, are avenues for getting you in touch with your suicide prevention coordinator at the local facility. Another video here, again, I'm not going to show it right now, but this one provides sort of that same behind the scenes look at VA suicide prevention coordinators. This is the suicide prevention team from New Orleans, Louisiana. I apologize, we don't have anybody dressed quite as fancy as this guy on our team, but these are actual VA responders. So these are folks that if you called from the New Orleans area, you would get one of these folks. If you call from the Western Washington area, you get one of these folks. These are my current team of suicide prevention coordinators here at VA Puget Sound. Okay, so they answer those follow-ups for all of Western Washington. And the reason that I show their pictures to everybody is because these are the folks that you will be talking to. Okay, there's 13 of them, except for this little guy. He doesn't answer the phone very well. He's actually a kindergartner now. This is an old picture. But you'll see we have a couple of veterans on our team. B is actually still active duty. She just got promoted to colonel. We have 260 years of social work experience across this team. So you're not getting that person like me 23 years ago who was a college volunteer. You're getting folks with the highest level of licensure within the social work discipline to take those calls and respond and make sure that the crisis is handled by a professional. Okay, so you're probably thinking to yourself right now that you can't read the words on this slide. That's intentional. This is a list of all the things that our suicide prevention coordinators do in their day-to-day job. Not all of these are related to the Veterans Crisis Line. So I made them small so you can see that there's a lot of stuff. But as it pertains to the crisis line, these are the core duties of our suicide prevention coordinators, okay? We're responding to calls by noon of the next day. So if somebody calls the crisis line at 10 p.m., right, they're going to talk to that 24/7 support at the Veterans Crisis Line. That may be 15 minutes, as you saw on Elizabeth's slide for average length of call. It may be an hour. It may be 2 hours. We try not to keep folks on the phone that long, but some emergency calls can go quite that long. At that point, with most crisis services, you're going to disconnect and you're going to go back to try and implement all those skills that they tried to communicate over the course of that call. Now, with the Veterans Crisis Line, that it doesn't end there. So 10 p.m. call, by 10 a.m. the next morning, you're going to have a call back by one of our suicide prevention coordinators here at the VA hospital to check in and see, how are you doing? Is there anything else that we can help you with? Hey, by the way, what's your next step in their plan for getting mental health care? How do we facilitate that happening? Okay. So following up on crisis calls, following up on emergency dispatches. If you are one of those folks that needs to get to an emergency room, we're going to call that emergency room. We're going to check in and say, hey, have you talked to the doctor yet? What's the plan? Are you going into the hospital? Are you going back home? Okay, you're going back home. Do you have a safety plan for how you're going to manage that crisis after you get back home? If not, let's put one together right now. We do suicide risk assessments. If we need to, initiate welfare checks and work with emergency responders to make sure those welfare checks go off in a seamless way. We work with our police, and in Washington State, our DCR system. We work to connect veterans with eligibility here at the VA or with the VBA, the Veterans Benefits Administration. We connect veterans to housing resources, to emergency service, to same-day mental health clinics. You name it, we are the kind of hub in the hub and spoke model for VA care to get folks where they need to be. So let me go back to this diagram because we didn't talk about these 1.7 million referrals down here. Those are the number of crisis line calls to the Veterans Crisis Line that end up connected to a suicide prevention coordinator. Again, the caller to the crisis line can choose to remain anonymous. And if it's not a true emergency situation, that anonymity is going to be prioritized. If it is an emergency, we have to send out an ambulance or police, or if you elect to have your information shared, then you get referred to the local VA hospital for this follow-up. So of those 1.7 million referrals, what does it look like locally? Well, this is the past 15 years of our crisis line referral volumes from 988. And you can see back in 2010, it was 357, right? That's a drop in the bucket compared to where we are now. I look at this line and I don't think that this is a bad thing. You might look at it and think, man, there's a lot more people in crisis now. I look at this and I see a population of folks that are willing to call the crisis line and know exactly how to do that. And so I see this as a really positive thing. I want to highlight that jump in FY22 when 988 launched, and you can see that increased our call volume by about 1,000 that year. That's another good thing because it means that folks know about 988 and they're using it. Jennifer, we have about 500,000 veterans in the Puget Sound region. And so of that 500,000, you're seeing about 5,000 that will be referred to the suicide prevention coordinators at the VA. That's only about 20% of the total Veterans Crisis Line volume. So we're looking at around, gosh, what is that? Anywhere from 1 to about 20% of the total veteran population. Now, I try not to be a competitive person, but I have the data, so I like to look. And what you have here is a comparison of where we fall in the other major crisis line markets for the VCL. And we are consistently in the top 2 or 3 overall. Atlanta, #1 every single year. I don't know what's happening there. That is just to be expected at this point. But usually what you see is that we are in a race with North Texas, which is really the Dallas area, and Houston around the number of crisis line calls that are handled in our areas, right? And so this year we happen to be slightly ahead of Houston. Sometimes they're ahead of us. But when you look across the nation, we are right there at the top. And if you go to that very last column over here, we're over 4 times the VA average in terms of the call volume here at VA Puget Sound. The national total for referrals to SPCs, 192,304. We're getting about 5,000 of that total. What happens once our suicide prevention coordinators get the alert to follow up on that call? Well, a follow-up attempt is made within 1 business day in 99.8% of those cases. The 0.2% where that doesn't happen is typically because there's an ongoing emergency response. And we don't want to get in the way of those police and firefighters and emergency responders that are actively transporting a veteran to the hospital. And so we'll usually hang back and let that play out, and then we'll reach out to the veteran. And sometimes we sacrifice the metric a little bit to do that. But I'm comfortable saying that 100% of the time we're doing these follow-ups, okay? We have 3 days once we start that follow-up to close out that call. And we do that with success in 97.7% of the cases. Again, that 2.3% where that doesn't happen is usually because there's some extenuating circumstance, but it's being worked on during that whole time. Some other numbers here that I'm really proud of. The average number of days for that first follow-up attempt half a day. Okay. So again, this is a 24/7 resource. Folks can call at 2 in the morning. We're going to be calling back starting at 8 a.m. that next morning. Sometimes we're waking folks up because we want to get that call. It looks like a really serious situation. We want to check in and make sure they're doing okay. Maybe they've gone to sleep. We'll try to, edge those later in the day. But sometimes we can't do that. And so we end up calling, within a couple hours. We have a process for calls that come in between about 6 a.m. and 10 a.m. They get called that same day. So they may have called the crisis line at 8 a.m. that morning, and they're getting a call back from their VA hospital at about 9:30. So really proud of that low number there. And then on average, how long does it take us to follow up with a veteran to actually get them back on the phone with us? About a day and a half. Again, folks can call in the middle of the night. A lot of times they're intoxicated. When we call back that next morning, they're not picking up the phone. Okay. So then we engage in a process of repeat calls over the next several hours, over the next 2 days to try and get them back. This data just shows where in Washington those calls are coming from. So about a quarter of the calls are coming directly from the Seattle metro area, the 206 area code. Again, we're using the area codes for the map. It's the geolocation, like Elizabeth mentioned, that gives us the actual location to put on the map here. The rest of that, kind of half in the non-green colors are coming from the Seattle-Tacoma metro area, a little bit from the east side. And then roughly, a little more than a third of the calls are coming from the more rural areas to the northern part of the state and out on the peninsula and down towards Oregon. We don't take calls from the eastern half of the state. We'll take them, but we'll transfer them to the appropriate VA. The Spokane VA or the Walla Walla VA will handle those calls. So the question I hope everybody is asking themselves at this point is, does this work? Is there data to support this? And I'm really happy that we can say yes, there actually is. So there was a study here done of 1,300 veterans who had called the crisis line, and that crisis call was associated with an actual suicide attempt. And what they found is that for every contact with a suicide prevention coordinator after that call was resulted in a 4 to 5% reduction in the odds ratio of an additional suicide attempt over the next 12 months. Now, oftentimes, if there's actual suicide behavior that occurs, we assign what's called a high-risk flag. That mandates at least 4 contacts over the next 30 days with our suicide prevention team. So we're talking about potentially a 20% reduction in that 12-month suicide risk, starting from that point. And just a nice quote here from that study. I've included the citation as well there at the bottom. So we're about out of time. I'll pause here and just say thanks. One more plug for using 988 and then pressing 1, and I'll turn it back to the WDVA folks.
Yeah, thank you so much, Larry.
Thank you so much, Larry. Thank you so much, Larry.
I'm echoing there. Sorry about that. We do have a quick moment or two if we have any last questions for anyone that would like to ask Elizabeth or Matt or even Larry. Just reviewing the chat too.
Can I ask? I don't know if I'm a wind tunnel. People have been complaining I've been sounding like a wind tunnel. But if you can hear me okay. I'm curious, if you don't receive a call back or you can't, that person doesn't answer, at what point do you do a care crisis intervention or whatever?
So I know for us, the answer there, Peter, is it depends. It depends on the reason for calling, right? If they are in a true emergency and they're able to get stabilized, we get that referral and we start following up and we can't get them. If we're concerned about their safety, and what we'll do first is sort of reach out to a family member, their next of kin or emergency contact in the chart, and just say, hey, we're trying to reach Peter Schmidt. Can you put us in contact with him so that we can follow up on something, right? We're not disclosing any information. We're just asking for that connection. If at that point we still can't get a hold of them, we may be contacting a mobile crisis program or something like that to do some field outreach to that individual. If they're calling because they want to initiate counseling services and there's not an emergency, they just don't know how else to do that, we'll call 3 times over 3 days, try and get them. If we don't get a hold of them, we're going to mail them a letter with information where they can reach back out if they want to reconnect on those services. So it really varies depending on the acuity of the situation.
Thank you.
Yeah, thanks for that, Dr. Pruitt. And as we wrap it up here, I just want to take a few last moments just to thank Elizabeth and Matt and Dr. Pruitt for their time and presenting today and providing these resources. Elizabeth provided a lot of really useful resources there in the chat. And I know I'll drop our WDVA Suicide Prevention and Awareness Month Toolkit website here in the link, and we'll make sure we get those resources added to our toolkit as well too. And feel free to reach out if you have any additional questions on 988. Emails are there in the chat, or you can always reach out to our Suicide Prevention Program team at connect@dva.wa.gov. I'll make sure I drop that in the chat. Otherwise, thank you all again for attending. We will share this recording once it's published on our YouTube channel. And everyone have a great afternoon.
Thanks, Gary. Bye.
Thanks, everyone.
Adios.